What do you think is the correct answer for this question? If you know the answer, please put it in the comment section. Hello dear students, myself Dr. Maddineni was welcome to Crack DrMSD. So the question says there is a woman having persistent acne which is not responding to antibiotics and even the best drug isotretinoin. So what do you think is the next best step? Please remember students, it is going to be evaluate for hyperandrogenism. So there could be a woman who is having excess androgen production, like for example in the case of polycystic ovarian syndrome, where there is going to be hyperandrogenism, which is going to be the most important reason for a woman to have isotretinoin resistant acne. And what can be the clues which the examiner may give you to help you diagnose this? There can be a hirsutism or irregular menstrual cycles mentioned in the question, which are all pointing towards elevated androgen levels. And why is it not dietary triggers? Because even isotretinoin is not able to control the acne, so we can rule that out. Why is it not any drug triggers, like for example steroids or phenytoin lithium? See, because drugs can produce drug-induced acne, which is called as acneiform eruption, and corticosteroids is a very important reason for drug-induced acne. In the question, there is going to be a mention of monomorphic acne, but that is not mentioned in this particular question. And also in chronic treatment resistant cases, particularly in the females, remember endocrinological causes are more likely than the drug triggers. So we can rule this option also. And why is it not checking the antibiotic resistance? See, antibiotic resistance is a genuine concern, no doubt, but isotretinoin acts independently of the bacterial resistance by acting on the sebum and reducing the sebum. Whereas here, even isotretinoin, not just antibiotics, are not able to control the acne. So it is basically some non-infectious mechanism, that is higher hormonal imbalance, which we need to think of. So that is the reason why ultimately we have this acne which does not resolve despite oral isotretinoin and antibiotics, especially in the female. The evaluation of hyperandrogenism is going to be the most important next best clinical step. So I hope you have understood this concept. So if this was helpful, please do hit that like button. Also do subscribe for more such awesome videos on a regular basis. Thank you so much. We'll meet in the next video. Happy learning. Sarvam Sri Krishna from Sarve Jana Sukhino Bhavantu.